What do you think of when someone mentions health? Do you think about how often a person gets sick, how often they exercise, how they eat? What about mental health? Do you think about how someone experiences stress, belonging, security? Do you think about genetic predisposition to different aspects of health? What about the social and cultural factors that play a role? The health of the planet, of our food? How do all of these things interact to influence your health, and how much of this feels like it is in your control? One impactful example of the intricate, interconnected nature of health is the COVID-19 pandemic. Everyone on the planet, and even the planet itself, was impacted by the pandemic in some way. The coronavirus that causes COVID-19 has been detected in wild animals, pets, wastewater, humans, and the environment we all share. This isn't just a human health issue.
So what lessons have we learned from the fight against COVID-19? How are we going to prevent future pandemics? And do you think we can achieve this by simply focusing on humans alone? Or do we need to also keep biodiversity and the health of animals and the environment in mind? As you can see, the questions of how healthy we are, what influences our health, and what steps we can take to be healthier are complex and intertwined. Health is an example of a wicked problem. It's complicated, hard to define, with many different sources of input and lots of potential consequences, but also limitless potential solutions.
At NC State's Global One Health Academy, we are taking an interdisciplinary approach to this wicked problem and bringing together the whole Wolfpack to work towards solutions. Here's one example. By the year 2050, it is estimated that one particular global health concern will lead to the death of an estimated 10 million people, about 2 million more than cancer. In the year 2019, this issue was associated with 4.8 million deaths globally. So we are already well on our way to the grim 2050 prediction. Can you guess what this leading cause of death is? It's a bacteria that are not able to be controlled by drugs, which is termed antimicrobial resistance. We all know about the COVID-19 pandemic, but drug-resistant bacteria is another silent pandemic that we are currently living through. It's a complex problem that can only be solved through an interdisciplinary approach like that of One Health.
One Health is a research framework that recognizes that the health of animals, humans, plants, and the environment are all connected. It brings together scientists and practitioners from across disciplines such as medicine, veterinary medicine, public health, basic biological sciences, and social sciences, to name a few. These different disciplines and sectors work collaboratively at the local, regional, national, and global levels with the goal of improving the health of these connected systems simultaneously. In essence, One Health works to achieve optimal health outcomes for all of Earth, including people, pets, wildlife, plants, and ecosystems as a whole. To solve wicked problems in global health, it's critical that we use an interdisciplinary One Health approach.
Let me explain One Health by diving deeper into my research on antimicrobial resistance. These drug-resistant bacteria significantly burden us locally, nationally, and globally. So why is this an excellent example of the need for a One Health approach? It is because drug-resistant bacteria are found in humans, animals, and the environment we share, and they spread between these different systems easily through human contact with pets, wildlife, contaminated water, and even the food that we eat. We have high projections for future deaths because, in the past, we have tried to find solutions to this challenge by working on only single components of the problem at a time, with scientists in different disciplines studying humans, animals, plants, and the environment in isolation. We know now that to solve this silent pandemic, we must work together using the One Health approach. Only then can we find solutions to this wicked problem. We have deep expertise in One Health at NC State. The NC State Global One Health Academy is a university-wide interdisciplinary effort to engage faculty, staff, undergraduate, and graduate students in improving the health of animals, plants, biodiversity, and human society in North Carolina and beyond. The Global One Health Academy works to expand NC State's One Health research and education efforts, increase interdisciplinary opportunities for undergraduate and graduate students, and develop evidence-based recommendations for tackling current and future global threats. Research within the Academy considers three primary areas that address the 2030 United Nations Sustainable Development Goals, driving food and water solutions, addressing climate change and health disparities, and combating infectious diseases, including antimicrobial resistance.
The Global One Health Academy has many opportunities for undergraduate students to learn more about One Health and to get involved. Students across all of NC State's colleges and programs can enroll in the Global Health minor to gain an understanding of current global health challenges and an appreciation of interdisciplinary approaches to addressing global health needs. You can also explore opportunities to participate in and even to lead research projects under the mentorship of NC State's outstanding graduate students and faculty. There are so many things that are unknown about the natural world, how its components interact, and the implications for health. And you can play a vital role in making discoveries and applying them to benefit society.
Throughout this course, you will be introduced to topics in global health, epidemiology, and infectious diseases, environmental health, and how they relate to basic needs. As you learn about each of these topics, consider how these issues are interconnected, how they can impact health for humans, animals, plants, and environments alike, and how different disciplinary and personal perspectives could lead to unique approaches that together contribute to solutions for these wicked problems. Optimizing global health depends on a One Health framework. Your health is our health. As you go through this course and hear about the exciting work being done at NC State to create a healthier world, I hope you can begin to envision how you might play a role in creating a healthier future for us all.